Professor Khangelani Zuma of the Human Social Sciences Research Council is the head of Biostatistics with them. This following a report around HIV statistics across South Africa, very specifically with a focus on the 50 to 54-year-old age bracket, giving a very interesting dynamic in Gauteng province, in particular around the prevalence of HIV/AIDS in that age bracket. Very specifically, 1.7 million plus South Africans in Gauteng continue to live with HIV/AIDS, despite the fact that the rate of contamination, or the rate of spread of HIV has slightly slowed down by 0.2%. Prof. Zuma, thank you so much for your time. Really do appreciate it. The 50 to 54-year-old age bracket is a very interesting age bracket. Why is it an age bracket that seems to have stood out in terms of behavioral dynamics when it comes to HIV and AIDS?
Thank you so much for inviting us, and good afternoon to your viewers. Well, maybe we just need to contextualize the statistics a bit, in the sense that, yes, the statistics are of concern that the 50-year-olds, 50 to 54, it's a group that had the highest peak in HIV prevalence in 2022 compared to other age groups, which were all lower than the 32.2 that we've seen. However, we need to look at this in relation to the statistics of 2017 from the same HIV prevalence survey that HSRC has been conducting since 2002, in the sense that in 2017, HIV prevalence was among 35 to 39 at a peak of 31.9%. Now, because people are now put on ARVs, the HIV epidemic is aging. So people are living longer with the HIV because they are on ARVs, and that's why we encourage people to take ARVs. Therefore, it is not surprising that the curve is shifting towards the right-hand side, so epidemic is shifting towards older people, and therefore this time around the peak is among those that are 50 to 54 years of age. However, of concern is that the peak is not at 31.9, it has slightly increased to 32.2, an indication that there could be a possibility of new infections in that age group. Not significantly, but that increase is of concern.
Yeah, if you were to sketch this out on a bell curve, would it behave in a way you would have expected? That is to say that the majority of people you would have expected, projected to be living with HIV/AIDS, falls into the age brackets where you would expect that being around the 31 to 32 age bracket?
Now, the age bracket will shift from 2017 to 2022, and that's what we've expected. That is, we would want, as more people are on ARVs, would want that we reduce new infections. And we are seeing that among younger people. If you look at in 2017, the 15 to 19-year-olds, the prevalence was 44.6%. But in 2022, it is down to 2.0%, meaning there are fewer new infections among younger ones. But when you go to older people, because most of them are more likely to have been on ARVs, so they live longer, are no longer dying as it used to be the case. So the curve is shifting. However, it is still a concern that among the same older people, a high proportion of them do not know actually their HIV status. We found them in the survey that they were positive, but they did not know. Some of them that knew that were positive, 23% of them actually were not on ARVs, and that is a concern that also want to highlight.
How much of this has got to do, especially when you look at the reduction of prevalence amongst young people, shifting from 44.6% all the way down significantly, how much of it has to do with a change in sexual behavior or just the effects of ARVs? Very specifically, that it is expected that a lot more young people have become undetected, that is to say that they can't infect people going forward, despite the fact that their sexual behavior may or may not have shifted?
The concern is that sexual behavior actually has gotten worse in the wrong direction. The rate of condom use has gone down. The age at sexual debut, even though among the 15 to 19-year-olds, better than the previous years, but we still find the young ones, 15 to 19-year-olds, starting sexual activities before the age of 15. Now, a big contribution to this change is due to access or wider access to antiretroviral treatment. And we can see that higher proportions of people, for example, in Gauteng, are on ARVs compared to what we had in the previous survey. So that is encouraging, and more people actually are now virally suppressed compared to what we had previously, and therefore people who are undetectable are less likely to transmit the virus to other people. However, among young people, the concern is that they are least likely to be on treatment, and that is a problem. Quite a considerable proportion of young people do not know their HIV status, and those that are HIV positive are less likely to be on ARVs compared to older people. So we need to do something there.
Yeah, just perhaps, Prof. Zuma, can you calculate into this equation for us the impact that pre-exposure prophylaxis may have had on the skew of the data we have right now?
What we found in this survey is that a number of people actually did not know about PrEP. However, those that were asked if had they been exposed to PrEP before, would they use PrEP? A number of them indicated that yes, they would use PrEP, because in Gauteng, for example, we asked among the 15 years and older, 33%, only 33% said they've ever heard of PrEP, and only 4.6% of them said they've ever taken PrEP, and only 1.5% are currently taking PrEP, and a significant proportion indicated that they would take PrEP if it were to be available, and that's about 65%. So you can see that there is a demand for PrEP.
Yeah. Prof. Khangelani Zuma, thank you so much for your time. Really do appreciate it. Head of Biostatistics at the HSRC.